Thank you very much. It's a great pleasure to be here, to be the first person to kick off this conference this year, and I really appreciate all of you coming. We've got a great program. The Medical Association and Hospital Association have tried to put something together that really speaks to the issues challenging and facing our country today. David mentioned this challenge about the way forward. What is the right way forward for healthcare? Thanks to healthcare reform, many of our colleagues around the country feel like we are in the dark because we don't know where the healthcare delivery system is going to be in the future, because we don't know where we're going to find caregivers sufficient in number to take care of the baby boomers, because we don't know whether the government's going to try to run healthcare, because we don't know whether this Healthcare Reform Act is going to be repealed or defunded as the conversation goes now in Washington. Trustees, administrators, and physicians, that is the audience here. And I can tell you from my travels around the country that trustees, administrators, and physicians all over this country are anxious right now. Your colleagues, our colleagues as medical and hospital associations, we're all trying to figure out what to do. And the best thinkers in our country in medicine, in health policy, in health administration, they are searching for high-performing health systems to emulate. They want to see models that they can follow that will lead them to success. And what I want to tell you today is they're in for a shock, because they're going to find those in a place that is unlikely, and that is they're going to find them here in South Carolina. We are doing some things in this country that are unusual compared to most of the nation. The national media, as you know, loves to find amusing stories in South Carolina, things that we don't do well, colorful political figures. And you've seen that over and over. If you're a South Carolina native, you've come to understand that and wish it were different. What I want to tell you is we are teaching the national media to use different words when they refer to South Carolina. Words like leader and quality. And that's really exciting. The work we're doing together is doing just that. Let me give you a couple of examples. Thanks to the collaboration among your hospitals and among other respected institutions in this state, South Carolina is being recognized nationally as a leader in improving healthcare quality and healthcare generally, the healthcare delivery system. I've been asked a number of times recently in Washington by the president of the American Hospital Association, by Don Berwick, who is now the head of CMS. People are asking, what's going on in South Carolina? You guys are doing great things. I had a colleague this week from Florida, my counterpart, who said, I'm really impressed with what's going on in South Carolina. So many states are talking about improving health care. You guys are actually doing things about it. And that's gratifying to go to a national meeting. A year ago, they were asking me about, who's the guy that said, you lie? This year, they're saying, what are you doing in the area of quality of care? It's really impressive. And that's the kind of conversations we want to have. So let me give you a couple of stats. The U.S. Department of Health and Human Services has recognized South Carolina in the last month as one of the top 5 states in the improvement of hospital care. That's great. Great news. That's enough to make us feel good, but it's not all that's going on. We have also recently been recognized as having the second highest performance among all states in the treatment of patients who are having extreme or serious heart attacks, STEMI heart attacks, ST-elevated heart attacks. We're next to the top in the nation in doing that. One of the very best states in taking care of heart attack patients. That's because of the collaborative work that you're going to hear more about later this morning. We rank second in the nation in terms of inpatient satisfaction. You know, we all worry about the HCAHPS score, and that's one of the core measures. Well, we should worry about it. We always want to improve, but actually the rest of the country's worried about how they get to be as good as we are. Those are great things, and what I want to suggest to you is the reason that we are being recognized as a state can be summed up in one word, and that is collaboration. Now, what do I mean by that? The collaboration in our state is unusual, and we take it for granted because we're participating in it, but when I go to other places, I realize it's unusual. Let me give you a few examples. The 100,000 Lives campaign that IHI kicked off, we were not the first state to jump in on that campaign, but once we did commit, we became the state with the most supporting partners. In other words, we attracted more organizations to work together on that than any other state. The 5 Million Lives campaign was a follow-on to that. When that campaign finished, you as a hospital and physician community said we should continue this work. Let's form our own campaign or our own group, and you called that the Every Patient Counts Partnership. We want to make sure the public knows we care about every patient in this state. Health Sciences South Carolina is a unique collaboration in this country. Our research universities and our academic medical centers are in a partnership that is unlike anything we see in other states. And they are partnered, Health Sciences is partnered with the hospital community to make sure that as they develop innovative ways of delivering care, that we hand it to the patients at the bedside, that we translate that right into the care of every patient in our state. That is unusual in this country. The Senior Medical Leadership Council, which bridges our two organizations, is another example. But I want to talk to you about a few things that we've done in the last couple of years that have really made us unique in the country. This is the South Carolina Hospitals for Haiti initiative you see on the screen. You know, and we know how devastating the tragedy was in Haiti. Many of your hospitals said, let's do something. And so we gathered medical supplies and flew them to Haiti. We thought we'd fill up a plane. We filled up 3 planes and flew them down there and delivered them on the ground. Some of your hospitals also sent medical teams to care for patients on the ground. It was an inspiring effort, and you have made a big difference in Haiti. Governance of our hospitals is also a big issue, and David mentioned the Best on Board trustee training program. Why did we do this in this state? We recognized as a community that in the future, the expectations of governance of hospitals are going to increase formally. They're going to increase just as they've increased for publicly traded corporations after the Enron mess and the Sarbanes-Oxley Act. That doesn't apply necessarily to most hospitals, but it applies to some, and some of the concepts there will apply to more. We want to be sure that we are providing strong governance training. Our friends at Blue Cross invested in this with us because they believe it is the right thing to do to train board leaders. We're going to have a number of them recognized this morning, over 100 who have been certified since the beginning of this year. We also, as a state, did something that not many states have done, and that is we hosted a gubernatorial debate to hear about health care, to talk about health care. This is a seminal year because of all that's going on in Washington and because there are so many issues that affect our industry. We wanted to hear from the candidates in person. So we had a debate at the Hospital Association's annual meeting back in February. We had 5 of the candidates participated. Nikki Haley was unable to be there. Vincent Shaheen was. So one of the 2 who eventually became the gubernatorial candidates participated. But both of those 2 candidates, Haley and Shaheen, came to our summer meeting and addressed our executive leadership summit there. There are sharp differences between these candidates when it comes to health care, not just on their party lines, but on what they believe about health care. And we have, at your request, prepared a scorecard or report card to talk about how they rank, and those were given out at registration to each hospital for you to disseminate. Another place where we have collaborated and finally made a difference is the state cigarette tax. Now, the Medical Association was among the loudest and clearest voices in our state about the fact that we have to do a better job with increasing the cigarette tax, giving a deterrent to smoking. This campaign's been going on a long time, 8 or 9 or 10 years, and it signals a big change from the old days when you see more doctors smoke Camels than any other cigarette. I like the one where it says, the guy's blowing cigarette smoke in her face, breathe in her face and she'll follow you anywhere. With a gun, maybe. But we know a lot of people in our state and our nation are affected by cigarette smoking and tobacco use, and we want to make a difference there. The partnership between the Hospital Association and the Medical Association, we worked hard for that. Another place we've been recognized nationally is in organ donation. We have a significant initiative in this state going to try to prevent needless deaths. One of the places there are needless deaths is on the transplant waiting list. People who are on that could be helped if an organ were available. There are not enough organs to go around in this country. That's because there aren't enough donated. And so we want to increase the number of patients and patients who are served by increasing the number of people on organ donation registry. There's information here out in the lobby about the Scrubs campaign, and that is trying to increase the number of people on South Carolina's registry list to 1.1 million. We are one of the better states in the nation at converting a donor into organ transplantation. Another place that our collaboration has lifted us above the national average. Now there's another, one of our most creative programs we've done in the last year has been Crime Scene Investigators, a takeoff on GSI, or CSI, Crime Scene Investigators. We did Crime Scene Investigators to talk about hand hygiene. We've been recognized by the World Health Organization as the first statewide campaign and a model for other states. And we've done a lot of training. I want you to see the video that we used to really publicize this.
Dr. Rick Foster, Chief Crime Scene Investigator with the GSI unit. When is the last time you washed your hands? Did you wash your hands before you started eating?
I did not.
When's the last time you washed your hands?
Yesterday.
This is why it's so important to have the Crime Scene Investigation unit.
We've decided we have to reach the public. It's not about talking technical conversation with professionals. We have to reach the public. We've got to do it in ways that resonate with them. Now, while we're talking about preventing infections, one of the shining stars in our state around the H1N1 pandemic or epidemic was Georgetown Hospital System. They made a concerted effort to have all their healthcare workers vaccinated because they did not want to see the disease spread. And Bruce Bailey, the CEO, is going to tell us a little bit about how they did that and what they emphasized.
It was important for our hospital system to be pretty aggressive and progressive in our response to the potential pandemic from the H1N virus because we felt like it was unacceptable for our staff to expose patients to a potential harmful disease. But by and large, the medical staff was in full support of this program. The board was resolute in the idea that we needed to do it. And honestly, our department managers, our employee health staff just did a great job of making resources available to anyone who had concerns.
That was a tremendous example and a national standard. But one of our hospitals has been recognized nationally and has turned heads by receiving one of the most prestigious national awards for quality of care, and that's the McKesson.
The AHA McKesson Quest for Quality Prize honors hospitals that have demonstrated a real commitment to the Institute of Medicine's 6 quality aims: safety, timeliness, effectiveness, efficiency, equity, and patient-centeredness. Today, we honor our 2010 winner, McLeod Regional Medical Center in Florence, South Carolina.
We have initiatives ongoing throughout the year that's been informed by data, informed by the voice of the patient and the physician and the staff on where we need to work and close gaps. This year we're working on service excellence standards that could be consistent across the entire organization so that the experience in one department is the same in the next department based on these 10 service standards.
We're obviously very proud of McLeod. We are excited that the nation has found award winners in quality and safety in our state, in South Carolina, and the performance, the collective performance here is going to continue to move in that direction. What I want to bring to you, when you hear these things about the leadership position of South Carolina in quality and safety of care, I want you to recognize it comes from something that's different than other states. We have a common commitment to a common purpose, and that is elevating the quality of care in our state, and we are yielding uncommon results. Other people are noticing it. One of the most important things we've learned about the quality efforts to improve is that you have to stop and celebrate from time to time, and that's what we wanted to do today, stop and celebrate some of the great things that are going on in our state. I travel around the state all the time. I visited all your hospitals, I've visited with most of your boards and many of your medical staffs. I see the good things you're doing. Too often you don't see the good things each other are doing, and that's what we wanted to highlight this morning.